But what about Yervoy? Newer immunotherapies, they're more expensive. They may not be on anybody's pathway yet, but individual providers want to use them. What do you do about that?
I don't think there's any problem in using the drugs such as Yervoy for its specific indication of widespread or even newly diagnosed metastatic melanoma. We would never think of denying using the targeted agents or the immunotherapeutic agents when they're requested in a reasonable setting. So that's not a problem.
Now, we've all discussed safety too. In fact, it's come up every time pathways have come up, but safety is right up there, certainly efficacy, safety, benefit, cost. How do you evaluate safety?
Before I answer that, I want to tag on to the other question by saying that when we get people to report what they're doing in a pathways program and they have regimen choices that are outside of the pathways set of treatments, we measure that and we give it back to them. And what we want is people to, when they have the ability to do it, move to the highest value, which if we define that as the quality, meaning the best use of evidence-based medicine for best outcomes over cost, we want people to drive to value. Now, what we don't want is when we get these reports back to find that some people are 40, 50, 70% of the time going off pathway, because we all have heard this. Most of us have practiced in academic medicine or in other group environments, and you always roll your eyes when people continually say, when their results are outliers, my patients are sicker. Nobody's patients are sicker all the time. And so pathway programs help people to understand where they really are at. And rolling back to the safety question, I think pathway programs are something that consumers should really advocate for, because what it does is it puts some guardrails on the use of evidence-based medicine.
Okay.
And that's what we want.
And the safety comment really brings me back to a comment that you made earlier, John. You're right. We have ways to look at individual drugs, but if you think about from the consumer and the patient-provider experience, this is more about a chemotherapy treatment plan with all the support drugs and all the antiemetics. So when you start to look at safety, you start to ask the question of, so again, what's the total cost of care? What are the avoidable consequences of these very powerful and toxic drugs? And how well are those being managed? So if you just stop short of just looking at chemotherapy agents, you've stopped way too short. You've got to look at the therapy plan in general and begin asking the question of, so how are we doing? Are we really avoiding the avoidable consequences? And if the answer is no, well, you might be able to tie that to the drug, but you might not. It might be just a systems problem, or it might be early triggers to the ER. It might be poor follow-through, follow-up. So there may be something in the system that we need to address. So I think that pathways only get you so far in your value.
Okay. It reminds me what